Oceania encompasses the Pacific island states of Micronesia, Polynesia and Melanesia, and includes Papua New Guinea, East Timor, Australia and New Zealand. 3/4 of the total population of around 36 million live in Australia and New Zealand. Papua New Guinea has more than 7 million people, whilst 12 countries have populations of less than 100,000. The countries and states are widely scattered across an area of more than 8 million square kilometres. There are huge contrasts between different countries in the region. In Australia and New Zealand, the bulk of the population live in coastal cities, whilst the majority of the population in the remaining countries live in rural areas. There are stunningly beautiful remote areas of mountains and lowland plains, small islands and atolls, and some of the larger countries such as Solomon Islands, Fiji and Vanuatu themselves comprise many small islands. In the remote highlands regions, people live in small village hamlets or in larger villages, whilst in the coastal areas, traditional houses are the norm. There continues to be significant urban drift. Port Moresby, the capital town of Papua New Guinea, was a town of 70,000 in the 1970s, but it's now a rapidly developing city of more than 500,000 people. Such migration brings with it the problems of unplanned squatter settlements with minimal access to water and sanitation, high unemployment and major social problems, including the risk of housing demolition to make way for development. There are wide differences between countries in infrastructure, education, health service provision and health indicators. The figures for Australia and New Zealand are comparable to other OECD countries, although, as in all countries in the world, there are significant disparities between mainstream and disadvantaged communities. The under 5 mortality rates for Papua New Guinea and East Timor are still around 60. Good child health is dependent on many factors, the most important of which are living conditions, the level of female literacy, and financing for and accessibility to preventative and curative health services. As in other regions, there is, in Oceania, a correlation between under 5 mortality rates and female literacy. With the increase in GNP accruing from the mineral and oil boom in Papua New Guinea, the PNG government has recently introduced free primary education. There is, however, still gender disparity, if not in primary school entry, certainly in school dropout rates. And the contrasts between a remote school in the Solomon Islands or PNG or Vanuatu, where books, desks and blackboards may be non-existent, and a suburb in Sydney with state-of-the-art internet technology are stark. Infectious disease still accounts for the majority of child deaths in the poorer countries of the region. Pneumonia, meningitis, malaria and diarrheal disease remain the top 4 killers. Although Haemophilus influenza B vaccine has been introduced into the EPI program for most of the countries, the goal to introduce pneumococcal vaccine has yet to be reached. Achieving the required vaccination coverage to prevent outbreaks of vaccine-preventable disease has proved difficult, with several countries achieving less than 75% for DPT-3. And after having been free of measles for some years, several countries in the region have experienced large measles epidemics in the last year, with significant mortality and morbidity, the result of inadequate vaccination coverage. Safe water supplies are still not available for many communities, and understanding of hygiene is limited in some population groups. Malnutrition is a major problem in some countries, with undernutrition estimated to affect 18% of children in Papua New Guinea and around 12% in Solomon Islands and Fiji. Maternal mortality rates in many of the region's countries are high, and in Papua New Guinea, where only 1 in 2 women will give birth in a health facility, and in East Timor, they are alarmingly high. Neonatal mortality rates are correspondingly high, and they account for 50% of infant mortality. The common causes of neonatal mortality, as in other regions, are infection, birth asphyxia, and problems associated with low birth weight. Tuberculosis is a significant problem in some of the countries of the region. Papua New Guinea has a very high prevalence of 541 per 100,000. TB accounts for 7 to 8% of admissions to the children's wards of PNG hospitals and carries a case fatality of 13%. Multi-drug resistant tuberculosis is well established in the country, presenting considerable challenges to health authorities. Fortunately, the region has not experienced a major HIV epidemic. PNG has a prevalence of 0.5% in the reproductive age group, but even with this low prevalence, HIV accounted for 6.3% of deaths in the paediatric wards of Port Moresby General Hospital in 2013. Access to health services is difficult for many people in some countries of the region. There are major problems with road infrastructure. Some areas can only be reached by days of walking, or by expensive air transport, or by water transport. Aid posts and health centres may be closed, run down and non-functioning. There are in some countries issues of law and order, making it at times dangerous for health workers to reach some populations. Several countries in the region have population growth rates of more than 2.4%, posing a major challenge to the provision of health, education and other services. And there's a large unmet need for family planning services. So, how has the region done in its efforts to achieve MDG 4? These are the figures from State of the World's Children 2015. Only East Timor has reached the goal, but from a very high under 5 mortality rate in 1990. Australia is not far away, and Vanuatu is approaching a 50% reduction. Whilst this may look disappointing, it should be appreciated that substantial progress has been achieved in all countries, often in the face of formidable constraints. Malaria mortality and morbidity has been reduced in the region by the introduction and improved control of artemisinin combination antimalarials and the distribution and use of insecticide-treated bed nets. The introduction and appropriate use of oxygen concentrators has significantly reduced mortality in children with pneumonia and other severe illnesses, not just in the major hospitals but in district hospitals. Widespread availability and use of oral rehydration therapy has reduced mortality from acute watery diarrhea. New vaccines have been and are being introduced. Many countries have child health policies focusing on common problems and achievable goals. Many countries are focusing on simple and practical ways of reducing neonatal mortality. However, in some of the region's countries, there are clear deficiencies in the provision of primary health care. Whilst there is pressure from some quarters to focus on sophisticated hospital care, major progress will only come about by getting the basics of disease prevention and adequate management of the common illnesses right. There are many challenges to meet if the progress made can be maintained and accelerated. Some countries in the region are on the brink of almost unprecedented development In Papua New Guinea, there are almost untold resources in the oil, gas and mineral sector. But first and foremost, governments must be committed to using the various countries' resources appropriately. A functioning health system, adequately funded, equipped and staffed, will form the basis for continuing progress. A major unmet need for family planning should be addressed. Plans should be made for the effects of climate change. Some of the Pacific Island countries may well no longer exist in the future, and there will be changes in vector-borne disease patterns, among many other changes. The wider aspects of health, education, poverty reduction, and ensuring the rights of women, children, and disadvantaged communities, and infrastructure development are of equal importance. The paediatricians in the Oceania region have demonstrated commitment to child health in its widest sense, and it's vital that they continue to do so that children can thrive and enjoy life wherever they may be.